Cross-section of the eyelids is an important 10-marker question. So we have different layers in the cross-section. We have skin, subcutaneous areolar tissue, layer of stratified muscle, and there's going to be submuscular areolar tissue, fibrous layer, and a layer of non-stratified muscles, a smooth muscle layer, and lastly the conjunctiva. Beginning with skin, the skin is going to be elastic and it is fine and it's the thinnest in the entire body. Subcutaneous areolar tissue is nothing but the loose connective tissue which does not have fat, and it is the part which gets easily distended when there is edema or when there is any kind of blood which is getting collected there. Layer of stratified muscle has two muscles, that is orbicularis oculi, levator palpebrae superioris. Orbicularis oculi has three different parts: orbital part, pretarsal part, and preseptal part. The orbital part is the one which encircles the orbital margin, and this is going to be the pretarsal part, and this is going to be the preseptal part. The preseptal part is loosely attached to the underlying septum orbitale, and then the junction between pretarsal and preseptal part is separated by a palpebral furrow. The pretarsal part is very firmly adherent to whatever is the underlying structure. A few fibers of the pretarsal part will go and attach to the anterior and posterior lacrimal crest, forming the Horner's muscle, and a few muscle fibers of the tarsal part are going to extend to the eyelid margin, forming the muscle of Rayon. What is the function of orbicularis oculi is to close the eyelids, and they are supplied by the zygomatic branch of facial nerve. So when there is paralysis of facial nerve, obviously orbicularis oculi becomes defective. There is lag ophthalmos, that is incomplete or abnormal closure of the eyelids. Levator palpebrae superioris, it's present only in the upper eyelid. It has one single origin but inserts in three parts. Origin from the apex of orbit, and three parts where it inserts is the skin of lid, the anterior surface of tarsal plate, the conjunctiva of superior fornix. What is the function of levator palpebrae superioris is the raising of the upper eyelid, and its supply is by the oculomotor nerve. The next layer, after the layer of stratified muscles, we have submuscular areolar tissue, which means below the muscle there is an areolar tissue layer, that is submuscular areolar tissue. There is loose connective tissue with nerves and vessels lying in this layer, and to anesthetize the eyelids, injection we usually give it in this particular plane. Next layer is the fibrous layer. It is basically providing the framework to the lids. We have central tarsal plate and a peripheral septum orbitale. So we know that to the septum orbitale is attached the preseptal part of the orbicularis oculi. So central tarsal plate is the one which is giving firmness and shape to the lids. Dense connective tissue is what it is made of. The upper and lower tarsal plate join at the medial and the lateral canthi and attach to the orbital margins through medial and lateral palpebral ligament. In the substance of tarsal plate is where is the meibomian glands located. The peripheral septum orbitale, it is also the palpebral fascia. It is a thin membrane of connective tissue. Centrally it is attached to the tarsal plates. Peripherally it gets attached to the periosteum of orbital margin. And this is also perforated by a lot of nerves, vessels, and levator palpebrae superioris muscle. Next layer is the layer of non-stratified muscle fibers. So it has palpebral muscle of Muller, which lies deep to the septum orbitale. In the upper eyelid, it arises from the levator palpebrae superioris muscle. In the lower eyelid, it is the prolongation of inferior rectus which is forming this muscle. It gets inserted to the tarsal plate and it's supplied by sympathetic fibers. So paralysis of this particular muscle is going to result in Horner's syndrome. And last layer is the conjunctiva. The part lining lids is known as the palpebral conjunctiva. That is, the conjunctiva which is lining the lids is called as palpebral conjunctiva, which is three parts, that is marginal, tarsal, and orbital. And this diagram below shows a microscopic diagram of conjunctiva. This is epithelium, the adenoid layer, and the fibrous layer.